For over half a century, Canada has been a world leader in the production, use, and development of life-saving medical isotopes. The world is counting on Canada to expand this leadership role to support the diagnosis and treatment of cancer, ensuring medical equipment is safe for use, and to tackle some of our greatest challenges in health sciences. Welcome to the Canadian Nuclear Isotope Council's Isotopes for Hope podcast with your host, James Scongack, Chair of the CNIC. In this series, we interview Canadian leaders who are making a difference every day. We hope you enjoy this episode of the Isotopes for Hope podcast.
Kurt, I'd like to take this opportunity to welcome two of my favorite people in the world to our first Isotopes for Hope podcast. And with us today, we have Dr. David Hodgson, who is the Medical Director of the Pediatric Oncology Group of Ontario, and Dr. Mark Greenberg. Before we get into the conversation, I'd like to share with you a little bit about the background of these two outstanding individuals. Dr. Hodgson, as I mentioned, is the Medical Director of the Pediatric Oncology Group of Ontario, and also holds the POGO Chair in Childhood Cancer Control at the University of Toronto. He's had a long and distinguished career and is a professor in the Department of Radiation Oncology and the Institute for Health Policy Management Evaluation at the University of Toronto. He has authored over 100 peer-reviewed manuscripts in the fields of childhood cancer, lymphoma, long-term survivorship, and his work has been cited in publications in 5 languages. I've had the opportunity to work with Dr. Hodgson through my and my wife's volunteer work at POGO, and I can tell you that he is an individual that is exceedingly dedicated and committed to the cause of childhood cancer and doing everything we can to help kids, families, and survivors over the long term. Also with me, as I mentioned, I have Dr. Mark Greenberg. He is the co-founder of the Pediatric Oncology Group of Ontario. He served as POGO's medical director from 2002 to 2012. He has also served as a professor of pediatrics and surgery at the University of Toronto and is a past staff oncologist and director of the aftercare program in the Division of Hematology Oncology at the Hospital for Sick Children. He has a long-standing career as a champion and advocate for the pediatric oncology sector. And he is a member of the Order of Canada, a very amazing distinction in recognition of his outstanding contributions in the field of childhood cancer. And the reason why these two individuals are two of my favorite people is for a couple of reasons. The first is between both of their careers, they really span the last 40 to 50 years of history in Ontario, which is really amazing, and how far Ontario and Canada have come. Obviously, a lot more to do. But one of the things we will talk about in all of our podcasts is how cancer is very personal. Dr. Greenberg was my wife's oncologist when she was diagnosed with childhood cancer, and Dr. Hodgson is her follow-up doctor. So it's just how the world comes together, but it really goes to show you how cancer impacts us all. So I really appreciate both you gentlemen taking the time to join me today.
Thank you, James. Yeah.
So I now want to start by talking about cancer generally. All of us will go through our lives and be touched by cancer in some way, shape, or form, whether it's ourselves, our loved ones, our family neighbors, people in our community, colleagues, you name it. We're all impacted by cancer. And maybe I'll start with you, Dr. Hodgson. As somebody who sits on the other side of the table when people are, coming through and you have to give a diagnosis, can you just sort of just take a step back and just talk to us about that impact of cancer? How prevalent is it, and what you see coming into your office every single day?
Yeah, well, cancer, of course, is extremely common, as you just pointed out. Childhood cancer, thankfully, is not common. There's roughly 500 new diagnoses in Ontario every year. And so that actually creates, from a systems point of view, its own challenges in terms of creating a system that effectively and equitably treats kids from across the province, no matter where they live, when there's those numbers that you're dealing with. And then, of course, the impact on the families is just profound. I mean, it couldn't be overstated. And the one thing I must say I've learned, and continue to learn just over and over again, is that a childhood cancer diagnosis affects everybody in the family, not just the child. And it has significant economic impacts. It's often the case that one of the parents, has to leave work because of the intensity of, helping to care for a child with cancer and get them through treatment. So if I had to say, there's one thing that I have learned over the course of my career that I didn't anticipate at the beginning, was that, this is not just sort of a technical problem that affects like one person, one child. This is a problem that, envelops the entire family when it happens.
No, I think that's really well said. And we know from the Canadian Cancer Society that 2 in 5 Canadians will be diagnosed with cancer in their lifetime. And every single year, 250,000 Canadians will be diagnosed. So it is profound. And as you say, it's not just that patient, that individual who's diagnosed. It's the broader family. I now want to turn to you, Dr. Greenberg. So maybe go back a couple of decades to the early 1980s, and when you and a relatively small but very dedicated group of people brought together, I think the best in our sector in terms of helping patients and kids and families to create POGO. Can you maybe just talk about what drove you to do that, and what was the take us through how that started?
Well, the early impetus resulted from a request from what was then the adult organization managing cancer for an update on pediatric oncology on a 24-hour basis. There wasn't anything to tell them because there was no coherent story. And we were very aware that what was happening in the pediatric cancer space is that it was somewhere in the hierarchy of need, but no particular focus was put on it from any of the institutions. There were 5 institutions in the province delivering cancer care. Each of them made the case to the Ministry of Health for funding, and that funding may or may not have stuck in the oncology space. Sometimes it fixed the emergency room, sometimes it was spent doing a variety of other things. We recognized that individual institutions were not effective in terms of advocating and policy development. And the way to do that was to pull together a community, a coherent group that would make that case and utilize what was then kind of new. We had started a registry, a database in 1983 that was really important in terms of identifying the numbers, the types, and the impacts of cancer in terms of morbidity and mortality. Initially, it was a bunch of docs. We brought in the nursing people, and then we brought in the psychosocial people, and moved forward to a rational model of supporting care. We said you need one oncologist for X number of patients, and one nurse coordinator for X number of patients, and one behavioral professional for X number of patients. And as that was developed and put forward to the ministry for funding, it was a rational basis for funding that brought everybody up to equivalency, floated the boats across the lake.
And you often talk, Dr. Greenberg, about the concept of healing, and we talk about that. There's always a really compelling picture that I look at on the front of the POGO brochure, and it has a picture of a young child, and it says, in 2 months he'll be diagnosed with cancer, and then it says in 20 years we will still be helping him. Can you talk about what that means to you?
I think what it means to me, and let me start at the beginning. When I or David or anybody else walks into a room to tell a family that their child has cancer, in that moment, their life changes forever. Not just theirs, not just the child's, but the extended family. the mum and the dad and the uncles and the aunties and the grannies and the school, and there's a ripple effect that permeates all of the social environment of that child and that family. And it's kind of unique in pediatrics in the sense that in the adult world, the unit of consideration is the patient. The family is important. In the pediatric world, the unit of consideration is the family, for all the reasons David alluded to. And the concept that it will change their lives for 20 years is absolutely correct. And if I may go back to the time when I started in pediatric oncology, we had a very low cure rate, 25, 30%. And we thought we were terrific when we elevated that cure rate to 40 or 50%. And our conclusion was, you know what, they're done. They're cured. They've lived 5 years, have a nice life. And the fact is they don't have a nice life necessarily, because the impacts of the treatment, both physical and psychological, persist throughout the life of the children and the parents. And as David has said, impact financial, social, and personal development.
We were at an event a couple of weeks ago, and the father of one of the survivors had an expression which really struck me, which was that just because you're cancer-free doesn't mean you're freed from cancer.
Right.
And again, I think a valuable lesson as a clinician is to understand just that. And so, when the treatment is over, the journey is not complete. Far from it. And I think to sort of understand that, to help families and patients, continue on in a way that's as healthy as possible to get their life back to normal is an important feature. But to understand that, as that dad said, to be cancer-free doesn't mean you're free from cancer.
And let's dig in on that point, because one of the areas as part of the Isotopes for Hope podcast series we have here, obviously this is our first episode, we're going to be talking with a lot of people who are in the field of developing new and advanced medical isotopes or better utilize them. Maybe I'll start with you, Dr. Hodgson. So thinking about precision oncology, we hear that term a lot. Can you maybe put into perspective for our listeners this concept we're talking about around precision oncology and what it means to that equation of the patient and the long-term obviously physical effects, but the long-term impacts from a cancer treatment?
Mm-hmm. Well, precision oncology sort of means different things to different people, of course. And as the term gets more and more popular, more and more people, co-opt it for their purposes. But really, I think the overarching concept is that, the treatment is as tailored as much as possible to the individual patient. And increasingly that means, understanding the molecular biology of the tumor, even understanding the sort of genetic background of the patient, and using that information to tailor the treatment, as carefully as possible to what that person actually needs. And actually an overriding theme on this is to minimize the late effects of treatment. So, cancer and its treatment can produce significant sort of persistent side effects or leave patients at risk of subsequent, health problems. And I think the overarching theme of precision medicine is not only to improve cure, it's certainly that, but to also do it in a way that, minimizes the long-term health consequences of having had cancer and the associated treatment for these patients and the survivors.
Now that's really helpful. And Dr. Greenberg, how should Canadians and Ontarians think about the treatments that we offer here at home compared to what you would see elsewhere in the world? How would you rate the tools in the toolbox that we're providing our frontline healthcare professionals to give families as much hope as possible?
So you're putting your finger on a big issue. A lot of families say, well, what would happen if we went to Boston, Minneapolis, Houston? The services and the availability of technology and treatment in all forms in Toronto, Ontario, and Canada is absolutely on a par with anywhere else. There is no need to look beyond our borders. Occasionally, in the development of new technologies, we lag a little behind. Usually that's the result of our very stringent health protection board. But there is no question that our level of practice and our outcomes are equivalent and maybe in some cases better.
Yeah, I think we have real incredible expertise in, certainly in Ontario and everywhere in Ontario, not just in Toronto, everywhere in Ontario have real expertise. And we have a well-coordinated system. So there are, again, in a circumstance where there's, 500 new cases a year of childhood cancer, there is some centralization that's absolutely necessary. And so there are some services that are only going to be delivered in Ontario. But we have managed to create, again, thanks to, POGO, starting with Mark and his colleagues, a coordinated system of care. So even if you're in London or Ottawa, et cetera, and will need a treatment only available in Toronto, there's still capacity and a system in place to make that happen. I would say Mark alluded to it, and maybe a bit generously, I think. I do think, the outcomes of childhood cancer in Ontario, as he said, are unrivaled. Like, they are as good as you will find anywhere. I do think the system can be slow in the uptake of new technology. One that I'm very familiar with is, proton therapy, which is a way of delivering radiation therapy that's more precise and spares normal tissue. We are the only G8 country that does not have a proton therapy facility. In fact, we're dropping into the bottom of the G20 in that regard. In fact, but luckily, actually, recently there's been great movement with the ministry towards getting the funding necessary. So, we were making great progress in that. And then I'm sure that's not also the only example. Sometimes the time between a new drug, for example, being shown to be effective in a clinical trial, the results made public to the clinical community, to the world at large, and the time that drug appears as a funded drug on the provincial formulary, that can sometimes be almost a decade at times. So I do think that there is room for improvement in terms of the speed and our capacity to pivot to accessing new technologies in the publicly funded system.
And that's really one of the areas, and it sounds like the Canadian Nuclear Isotope Council in our next Isotopes for Hope report needs to increase our focus on the availability of proton therapy, and that's something I think in our advocacy role we can certainly do. And I want to turn a little bit to isotopes while we're with you, Dr. Hodgson, and from a clinical perspective, and I know you've done a lot of work with Dr. Rebecca Wong in the UHN. Can you talk a little bit about the role that medical isotopes play in either the diagnostic or the treatment of various forms of cancer that you see come through your door?
I'll speak to one that is near and dear to my heart, which is the management of lymphoma patients, which is what I spend most of my clinical time doing. And again, FDG PET, PET imaging, which uses a radio-labeled glucose molecule to identify locations in the body where lymphoma is. That has absolutely revolutionized the management of lymphoma. And so, when I started, what happened was so-called, risk-adapted treatment, in which you got some scans and took some blood work, and based on that, you identified how intensely did you want to treat a patient given the amount of disease that you saw and some of the other risk factors. FDG PET imaging, using radionuclides, completely revolutionized that. And so now the paradigm is that, you use the PET not only to understand the distribution of lymphoma within the patient's body, but also to assess the early response. And it becomes like a sort of a personalized marker of the lymphoma responsiveness to treatment. You give a couple of rounds of chemotherapy, you repeat the PET scan, and some people their lymphoma will evaporate almost immediately. And then that these patients don't need, a lot of intense treatment. For example, they can avoid radiotherapy. And whereas others, we know that we have to dial up the intensity of the treatment if their FDG PET is not responding. So that paradigm shift is like completely altered the way that Hodgkin lymphoma, for example, is managed. And cure rates have, really, they really exceed 90% in almost every stage of Hodgkin lymphoma now. And the side effects now are really substantially less than even when I started. Yeah.
That's really helpful. And what's really powerful about this conversation is when we're talking about the role of medical isotopes, when we're talking about our Isotopes for Hope campaign, we have to always remember there's real people at the end of the day that are counting on this. It's not some academic conversation. It's real people. And Dr. Greenberg, I now want to shift to you really along those lines. One of the things we said when we launched the Isotopes for Hope campaign a year ago was the world needs more Canada, almost from a moral imperative. And I think we all, we can all personalize this, as I mentioned in the introduction, but can you talk about very much when I hear about the formation of POGO and I hear about the advocacy in those early days and really how it's evolved to what Dr. Hodgson is talking about now. Can you talk about Canada's, and you're a member of the Order of Canada, and so that's why I'm kind of putting you on the spot on this one, is really the moral imperative we have as Canadians from a global perspective. Obviously, we here in Ontario and Canada want to take care of families and our neighbors and our loved ones. But can you talk about your perspective of Canada's moral imperative in this space?
So I think one of the successes of the model of POGO is repetition and recreation around the world. And that has been true in South America, in parts of Africa, to some extent in the UK. And the model basically has said, this is not a disease of cells and bones and brain and blood. It is all of those things, but it is a disease of parents, families, and the model has to be holistic. I hate the word holistic because it's used indiscriminately, like precision. Holistically means understand that the treatment and the cure are your first obligation, but looking after the family and the extended family and creating equity across all places where children are treated is imperative. There obviously has to be a hierarchy. One of the critical issues that we faced very early on dealing with South America was the lack of access to drugs. And, we worked on that for many, many years. Eventually, a critical drug requirement was identified and presented to WHO, which endorsed it. So that the model has been, let's put everybody's brains in one place and work out what surrounds that central piece, which is the nuclear family. And that model's been picked up in a variety of places, and it feels really good. I have to say it feels really good along the lines of moral imperative.
Well, I really want to take this opportunity to thank you both for joining us today. As I said at the introduction, you both mean a lot to me personally because of what you do. But there's thousands of people like me out there that would feel the same way, and your colleagues in this space. And I think what was so appropriate about this discussion to kick off this podcast series is really to bring it home as to what matters. And our commitment as an isotope sector in Canada is to come together, be aligned, do everything we can. So frontline providers like yourself here in Ontario and around the world have access to the best tools possible to give patients hope. It's not a guarantee. It's not the beginning and the end, but it's something that we believe as Canadians we have a moral imperative to advance. So thank you for your leadership and for kicking this off. And to you and all your colleagues on behalf of the Canadian Nuclear Isotope Council, we're not going to let you down. We're going to fight for this cause because we know it's important. We know it's one part of the system, but it's a part of the system we want to do everything we can to get right here and around the world. So thank you very much for joining us today.
Thank you.
Great pleasure. Thank you for having us.
Thank you for listening to this episode of the Canadian Nuclear Isotope Council Isotopes for Hope podcast with James Scongack. Please share this podcast and follow us to stay in the loop. To learn more, please visit our website at canadianisotopes.ca.